Home remedies. Isoflavones. Research shows that the dysregulation of estrogen may contribute to the development of endometriosis. A group of plant-based chemicals called isoflavones may help to reduce the symptoms of endometriosis by inhibiting aromatase, the enzyme that converts male hormones, that is androgens, to estrogens. Good food sources of isoflavones include celery, parsley, soya beans, chickpeas, fava beans, pistachios, and peanuts. Omega-3 fatty acids. Prostaglandins are a class of complex fatty acids that are largely responsible for menstrual cramps and pain caused by the endometriosis. There are good prostaglandins that alleviate inflammation as well as bad prostaglandins that do promote inflammation. Too much of one or too little of other can trigger the pain. Omega-3 fatty acids found in fatty fish such as salmon, mackerel, sardines and anchovies are believed to be beneficial to women with endometriosis as they are converted in the body to anti-inflammatory prostaglandins. At the same time, they appear to suppress the production of inflammatory prostaglandins derived from saturated fats in dairy and red meat. An increased intake of omega-3 fatty acid, more specifically a compound called eicosapentaenoic acid or EPA found in fish oil, can alter the balance of prostaglandins and alleviate many of the inflammatory symptoms of endometriosis. Turmeric. Turmeric is a mainstay of naturopathic medicine and a spice that may offer significant benefits to women with endometriosis. Turmeric contains an anti-inflammatory and antioxidant compound which is known as curcumin that has been shown to slow endometrial cell proliferation in test tube studies. It appears to do so by inhibiting the production of estradiol, the strongest of the three types of human estrogen. Green tea. Green tea is an anti-angiogenic and suppresses the development of tiny blood vessels that feed endometrial overgrowth and promote inflammation. Green tea appears to do so by blocking vascular endothelial growth factor C, a protein that is released by red blood cells. Castor oil. Castor oil has been used for hundreds of years to treat endometriosis. It can be used at the very beginning when cramping is first felt to help the body get rid of excess tissues. Choose anti-inflammatory foods. This won't offer fast symptom relief, but it could help manage the endometriosis long term. By avoiding foods that cause inflammation and increasing foods with anti-inflammatory properties in your diet, you can reduce symptoms in future. Foods to avoid include dairy, processed foods high in refined sugars, caffeine, alcohol. Foods to increase include green leafy vegetables, broccoli, celery, blueberries, salmon, ginger, bone broth, chia seeds. Pelvic massages. Massaging the pelvic muscles can help to relax them and reduce inflammation, reducing cramping. Using a few drops of high quality lavender essential oil can help further relax of the muscles. Gently massage the affected area for 10 to 15 minutes at a time. Pelvic massages should only be used before the menstrual cycle. It may aggravate the symptoms if you use it as a treatment during your period. If the symptoms worsen, you have to visit nearby gynecologist, and taking advice is also meaningful. Thank you all. Have a nice day.